This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult a qualified healthcare professional before making any health or lifestyle changes. Welcome to the Happy Healthy Her podcast, your go-to space for real talk, inspiration, and laughter as we navigate life as a woman. Let's dive in.
Welcome back to the Happy Healthy Her podcast, the show where we empower women to live their best lives, mind, body, and spirit. Hello, I'm Lorraine Kihm, an empowerment and mindset wellness coach, guiding women to live authentically through self-discovery and self-healing. I will be your host today, and I'm here with my two amazing friends and co-hosts. Tracey, would you introduce yourself?
Of course. Thank you very much. Hi, I'm Tracey Mail. I'm a health empowerment coach, helping people reduce their chronic pain and fibromyalgia symptoms naturally, using what I consider to be the four pillars of health. It's nutrition, mindset, movement, and recovery. Thank you.
Thank you, Tracey.
Okay.
And Cynthia?
Hi, I'm Cynthia Penner, a menopause coach and author of the Menopause Map book series, and I guide women through the wonderful, sometimes wild world of menopause. My focus is helping women navigate this season of life with confidence through knowledge of what the heck is going on in her body and hormones.
Thank you, Cynthia. And we're so excited today. We have a very special guest, Dr. Madori Griffin. She is a doctor of chiropractic who specializes in caring for infants, pregnant women, and she's currently expanding her education into FMCP. I hope I have that right. Functional Medicine Care Practitioner. I'm especially thrilled because Dr. Madori is one of my personal chiropractors and part of my own healing journey. So, Dr. Madori, everyone wants to know who you are and what you do. This is the part of the show where we're just going to sit back and hear the heart behind your work. Our listeners would love to know a little bit more about you and what drew you into chiropractic care in the first place. Why you chose to focus so deeply on moms and babies, and now what's inspiring your new journey into functional medicine. Take it away.
Yes, thank you so much. As she said, I'm Dr. Madori. I actually grew up with my mom, who was a chiropractor for several years, and I got to watch her go through school and see, the beautiful practice that she had created. And as a stubborn 18-year-old, I said, I'm not following in your footsteps. I'm going to be a respiratory therapist. So I went to school for that. I was like, I want to be in the hospitals. Always wanted to take care of people, but I was like, I'm going to do something different. And so I went to school as a respiratory therapist. I worked in North Dakota for about 4 years. I did NICU, PICU, flight respiratory therapy during that time. And then had moved back to California about 2019. I always knew I wanted to go back to school. I thought maybe PA or go back for nursing and then NP, just because something felt off when I was a respiratory therapist. I felt like not enough was being done. I was very limited in what I was able to do. I was quote unquote just a respiratory therapist, but I'm like, I have so much knowledge and no one wants to hear it. And so I just felt like there was more out there. And so I was looking into the chiropractic program, and I was like, I had taken classes all throughout my time working. I was like, I probably still have some more time before I can actually go for my doctorate. And they're like, you can start right away. And I was like, well, I need some time. I just moved back. And so just being in the hospitals, I was recognizing here and there. I didn't realize it because I was 21 when I started. I was very young, and I didn't understand why these medical practices didn't make sense to me. But looking back now, I'm like, oh, like my mom had always educated me in nutrition and all these other things, but I would have like diabetic patients getting amputations, and then I would go into their rooms and they would have like these awful meals and Coke sitting on there, and I'm like,
Mm,
That's not right, right? Like, and they would come back and come back, and I'm like, why aren't we addressing like the actual problem, why they're ending up in this situation? And they would just treat the problem, not the actual root. And so I guess it had been ingrained in me since I was young, to pick up on these things. And so it just seeing all these poor uses of practice, I was like, there's better out there. And so I knew I wanted to educate more. I was going through my own like diet journey, through keto and learning about nutrition and how it can impact our bodies and how it starts changing the pH and with breath work. And so many different things I was like playing around with when I was younger. And I was like, why don't people know about this? Everyone needs to know. And so just having a platform to educate and have a voice and be like, this is real, like this is helpful. And it doesn't have to cost hundreds of thousands of dollars to get there, and you can be healthy. And so I was like, I'm going to become a chiropractor, and then I'm going to focus on nutrition after. And so I got into the program about 2020. And I was still working as a respiratory therapist during that time. So I got to be a part of all of that. And then, because I was still on the fence of like PA, do I still want to be in hospitals? I love it. Or do I want to go more like holistic? And so working during COVID was just so eye-opening, and how poor the system was working and it wasn't working. And just to see all these providers just not care as much as I thought they should care. I'm like, why do I care about these patients more than you care about these patients? And just they didn't have the staff for it. I don't know. But I remember working as a respiratory therapist, and all of our supplies were gone, because it had just happened, and I don't know where they went. But we ran out of so many essential supplies for protective equipment. And so I had this patient, they were deteriorating. I went in with what I had around me, like I need to make sure they're okay. And it's like a big glass wall, and I'm working on the ventilator, and I'm trying to help this patient, and the doctor is just standing outside of it, like telling me what to do. And I'm like going through all these different things. I'm like, it's not working, it's not working, it's not working. And then there's like, I look back and there's doctors, like tons of them, like 5 to 8 doctors just standing outside the room, no assistance. And I was just like, okay, like I'm in this by myself at this point. And then we were never supposed to detach the ventilators because it was airborne. And why would you, like, we didn't know what COVID was going to do. Everyone was scared, like, what's going to happen? And so they're like, we'll take it off and bag them. And I'm like, okay, like I'm risking my life for this person. And I did it. But it was just like the fact that they even asked me to do that, not like, hey, let me get something on. We'll switch out so you can get better equipment on. And I was like, okay, this person's deteriorating. I'll do it. So I took him off. I had to bag him, get him back up and oxygenated. But I'm like, this is just like bandaging it. What's going on? Like, we need to fix something else. And so I finally was able to like get them back up. But just the fact that none of them had like even tried to come in and support me, was very frustrating. And then I was like, okay, well, obviously the ventilator's not working. It only does and can oxygenate and ventilate to a certain extent with such damaged lungs. And I was like, well, maybe we should prone the person. And that's us turning them onto their stomachs. And I got like, no, we're not going to do that. Why would we do that? Like, it's basic positioning, right? You're going to oxygenate the back portion of their lungs. And so I remember them just completely dismissing that. And I was like, okay. And then I come back the next day and she was prone. But I'm like, why would you wait? Why was that? Like, you heard me say it. You're like, no, like they waited until she went even further down the line. They had nothing left. And I'm like, you could have prevented that. You could have saved some of the lung. You could have had these options, but they were so ingrained in like what they thought they knew. And why would the respiratory therapist know? So it just solidified all of my like, I have a voice, I'm going to use it, and this is important. And so I love having that respiratory background too, because breath work and just the way we can control our physiology with breathing is silly. Like it's so simple, but it's so important. And not many people know how to breathe properly. So I just love that I have so much knowledge of the respiratory system and how that's so easy and it's free. And so taking that in and then doing my chiropractic care, I started working. I always wanted to work with infants. I knew it was a thing. My mom did a little bit of it. But then once I started doing my internship, I had a doctor. She's absolutely brilliant. It's Dr. Anastasia Lander. I worked at her practice and she specialized pregnancy and infants, and her approach to it was so incredible. So I'm Webster certified. So basically, what she did was all we're doing is trying to put the body in the most natural position that it should be in. And so that's communicating properly. Um, and so we got to work with moms and she educated so much on what we can say no to, how to advocate for yourself, how important it is to advocate for yourself. Like every woman's journey is going to be different, but say what you want and make sure it doesn't waver. And so she was really great about that. And then we had the infants, and she would take these tense, crying, awful, miserable babies. And by the time they left, their nervous system was just completely restored. They were calm, they could latch, like just performed miracles. And I was like, I want to do that. And so I was just like, I knew I wanted to work with it, but I didn't know why. And she just opened up this whole world for me, and how like not many people know about it. Not many people understand like the benefits that come with chiropractic care for that population and how important it is. And so I was able to be a part of that. And then like again through my own I did my own functional medicine journey while I was in school, or right before I started school. And I was like, this is it. This is the nutrition. This is the future of medicine. And so I like did my own functional medicine journey. I did all my blood work. I did everything they told me to do, the supplements and all of that good stuff. And I feel like I have tools for the rest of my life. Like I can always go back to it, but I'm like, I have the foundation. I know what my body's doing because they educated me on it, not just like, here, take this, this will band-aid it. So I had that aspect, and I was like, okay, like my heart was so set on that. I'm like, okay, I have to get my doctorate first and then I can go back. And so I did my chiropractic degree, and then now I'm in the process of eventually I will sit for my FMCP. That certification takes a little bit over a year, more of education before I can sit and take that exam to be certified. So I'm very excited for that. And then, yeah, that was my journey.
Oh, busy
So cool.
girl.
Yes.
So, I love that you mentioned how we're not told accurate information. Like, we're not just talking about women here, we're talking about everyone. But specifically for women, it's during pregnancy, postpartum, menopause. Like, we're brushed off or given cookie cutter advice, right? And you've shared some examples already, Dr. Madori. But what I would like to ask is about the functional medicine. Like, the one thing that you said, really, like, you knew exactly what you needed, exactly what supplements, exactly how to cure your body and to come back to optimal health naturally. Like, I've seen a functional medicine, and we were talking about it before because I do not remember the name of the scan that I was given. But at the end of the scan, she could tell me exactly what was going on in my body and exactly what I needed to heal it. There was no guesswork, but it also wasn't a chemical prescription. It was magnesium, and we did a detox, and we got rid of my parasites, and it was pinpointed and exact. So my question would be on the functional medicine, do you know the exact name of that scan, and kind of walk us through even, I guess, your own journey so that we have a specific example on how that helps?
Absolutely. The exact scan that you had done, I'm not 100% sure. So there's actually a pretty wide range of functional medicine schools out
Okay.
there, just like there would be different schooling for chiropractic. We have different philosophies. I'm going to the Institute of Functional Medicine right now. And I will have to look into that scan. So
Okay.
you get the name, let me know. But basically, with the Institute of Functional Medicine, it's more of like a blood panel, and then they'll do like a microbiome. So that would be a stool sample. We would send that in. We would figure out exactly what's in there. But it's basically like the gut map that we would get, and then we would go from there. But I know there's lots of different scans and options. Every functional medicine practitioner is going to do things a little bit different, just like any MD would do. They all have their different protocols and what they think would be best. MRIs, I know they have the option for that. That'll give you tons of information on your body and you can see exactly what's going on. But generally, from what I'm learning right now, it's all blood work, stool samples, and then we get a huge background on these patients. Like, we want to know what your mom's pregnancy was like. We want to know what your mom's birth experience was like. Was she stressed out when she had you? What kind of environment did you grow up in? Were there environmental factors? So we get so much more from, I think, the history, and that will give you, I would say, 80% of your information. And then the blood work is just the cherry on top. Really pinpointing what we need to do to get the root problem taken care of.
So that's definitely not a standard medical doctor 15-minute appointment, right?
Not even close.
Because up here in Canada, we're allowed 15 minutes, one thing at a time, and that's it, that's all. Like there's no huge background. There's like what you just described, that must take time.
Absolutely. I would say the initial consult takes about, if we're lucky, an hour and a half.
Wow.
Really diving into everything going on. Like, we create an entire timeline because there are certain triggers throughout our lives that will either increase our health or decrease our health. And so knowing what benefits you and for the patient to be able to see, like, oh my gosh, this started when I was 20 years old, and now I'm 40 and we have a lot of ground to make up because of everything that's gone on in between. And so really getting the information, what your gut microbiome when you were an infant, were you getting antibiotics, several times, you just wiped out your entire immune system. Of course you have IBS, or like, of course you have all of these chronic issues going on because you had to restart and regrow and you lost so much of your nutrition. And then so long ago, I feel like they were forcing formula instead of breastfeeding, and that is best. Yes, absolutely. But providing moms with support and being able to latch, being able to produce their own milk, being able to, really optimize. I feel like that was for a very long time not a thing. And so we've definitely done really great strides in emphasizing the importance of breastfeeding now, but there's still absolutely a lapse. And it's not really like, oh, baby's not latching, it's you, or baby's not latching, just give them formula, And so instead of addressing, like, why aren't they latching? Is it their mouth? Is it you not producing? How do we fix this? It's just, all right, so.
With that, it makes me, I had a question with that. If somebody is 80% is their history, right? What if they don't know their history? What if they were adopted or they just don't know their mom passed away and nobody gave them that information? How would you help someone like that? What would they do?
That definitely, makes it a little bit more complicated. But you would get everything up until what they know. And then again, the blood work is going to give us lots of information. The stool sample will give us huge gut insight of what they're going through, and then symptoms.
So you can still get help, right? You might have to do more digging otherwise. Good. Okay, my other question was for anybody like the listeners that are 35 and over who might be struggling to still get pregnant. People that still want to do that. They're noticing big shifts in their hormones. How could chiropractic care support them in aligning their bodies, whether it's to prepare for a healthy pregnancy or even just to bring more balance to their hormones during that time?
Absolutely. I would say it's both the male and the female we're finding. We didn't realize how much the males contributed to the whole process. And so they always were, saying the women were, why can't we conceive? So making sure your partner's taken care of, both physically, and then nutrition is a huge one. Obviously,
Right.
I went into nutrition too. But chiropractically, so all of the nerves of the spine innervate or go into all of our different organs, reproductive, the intestines, they go to all of our different organs. And so if you're extremely tight, those joints aren't quite aligned, your body's not going to communicate properly. Also, when we have look at the entire spine, you have your parasympathetic nervous system. So that's your rest and your digest. That's in the neck and in the sacral area. And then you have your sympathetic, your fight or flight, which is throughout the thoracic or the mid-back region. So when we adjust those different areas, we're re-regulating your parasympathetic nervous system and then down-regulating the sympathetic nervous system. And so you're chronically stressed, we can help mitigate a lot of that tension in the body, allowing it to relax and do what it's supposed to do naturally.
Cool. Nice. Thank you. Good.
Wow,
Good.
I've never heard chiropractic explained that way.
Right.
Like when you went there, it's usually, oh, I need alignment, my neck is out, my back is out. But you just described grabbing that whole system and just calming it right down. That's
Absolutely.
fascinating.
Oh, yeah.
Which leads me into what I have to say perfectly. So thank you for that transition.
Nice.
Because something I really love about your approach is that it's not just a quick fix. And it's understanding what's happening to the body, addressing the root causes. And that's something that many women don't hear often enough, and we're really urging, women to do. So we want to talk about what it is exactly and why it works. So, Dr. Madori, for those who may only know, as Cynthia was saying, chiropractic as back cracking or that one-off adjustment, can you explain what makes your approach to treatment so differently? Because I've been there and it is different from any other chiropractic office that I've seen, and it's really lovely that you have so many tools. And so maybe you can talk a little bit about the methodology, the technology, and what you've seen in your patients and how it can really change their lives.
Absolutely. So we spend an entire hour with our chiropractic patients. Even we do a pretty thorough consultation. We need to figure out, how long has this been going on? Because if it's been 10 years, you didn't just wake up and your neck hurt one day. You've had this problem off and on. The body whispers before it screams, and now it's screaming. And I can't fix that in one adjustment, unfortunately. I would love to. It doesn't work like that. And so we go through and we do the consultation, and then we go through the examination. We assess muscle, joint, nerve function. Is it a complex condition involving all of these things, or is it just a subluxation and you need to get an adjustment or two and move on? Generally, people who have never had adjustments, that's not necessarily the case. So we assess lots of different aspects, like I said, the muscle, joint, nerve, through our examination. And then we'll generally, if we're concerned there might be something else going on, we'll send for x-rays. Now that does just show the bones, right? I'm not going to see your disc. I'm not going to see the nerve being irritated. But when we see degeneration setting in, or if we see curvatures happening, that'll sometimes we'll find congenital defects. So something they were born with, and it was like, okay, that complicates things a little bit. This is realistically what we'll be able to do for you. But basically with the x-rays, we'll be able to tell if there's decreased disc space, your disc is getting smushed, right? And so there's bones and then there's discs. The discs are kind of like jelly donuts. So what happens when you smush a jelly donut?
Goes out the side.
Yep. Out, right? And so doesn't always completely come out, but it kind of like bulges. And then you have your nerves that come out of the spine. And that's generally the disc putting pressure on the nerve, right? And so we need to be able to address muscle, joint, nerve, and the disc. And so we have lots of different therapies in our office to just address all of it. So, like I was saying, I would love to be able to adjust someone and that fixes it. That'd be fantastic. Don't get me wrong, we can do a lot of work with that. However, if that disc is compressed, I can't sit there and stretch you all day, right? Like we need to get that disc some nutrition. So it's not highly vascularized. So it doesn't have a lot of blood flow in it. And so it gets nutrients through inhibition. So basically through, I like to think of it almost as osmosis, and like the nutrients will just kind of go into it, but it needs to be, you need to move to be able to get those nutrients to want to suck into it. And so most people, when you come in, your range of motion's decreased. And so you're not going to get that full nutrients into the disc. And so they're getting kind of dried out almost. And so they're not getting a ton of nutrients. They're trying to push out onto the nerve. And then also sleep is a huge factor in getting the nutrients in there, but they're not sleeping well because they're in pain and they keep waking up. And so you're not going to be able to heal when you're not sleeping. And so we try and have that conversation. And so we have our spinal decompression, and it basically puts you in, straps you on the top, straps you in the bottom, and it's very slow and controlled. So it basically pulls you apart and brings you back together very gently. And so depending on how acute the injury or how recent the injury will depend on how much we're able to actually pull. And so when we're able to pull, it gets that stretch that it needs to kind of vacuum suck in to get that disc rehydrated. So huge, super important for disc problems. And then we have our new favorite, it's the shockwave machine. And that basically is, have you heard of lithotripsy?
Oh, little.
So it's basically, they send sound waves into the kidneys to break up kidney stones. And so those kidney stones can break up with the sound wave. So it's that same exact technology, but for the musculoskeletal system. And so those sound waves are sent into the muscle tissues. So when the muscle contracts and relaxes, it should be able to glide smoothly. A lot of times when it's not gliding smoothly, it tightens. It'll start to crisscross and form adhesions over it. And so it's almost like a scar tissue. And so you can get massages, that's great. But unless we're actually addressing the fascia on top of it, we really struggle getting our results. And so the sound waves actually break up those adhesions, and they stimulate stem cell growth within our own bodies to heal and repair that area as well. So it's one of our non-surgical options. We either can prevent surgery for an extremely long time or prevent disease process from worsening, degeneration from worsening. And if we can get you to work on your nutrition and all these other things, we can actually go in the opposite way and help reverse some of the disease process in the spine, which for the longest time, they're like, oh, you have degeneration. Everyone has degeneration. And it's just not necessarily true, you know, like we a lot to help mitigate some of this. Not to say I'm going to cure the degeneration, but there's a lot that can be done with it. And then the other, we have a couple more. Cold laser, that one's an incredible one. So basically it's a grade 3 cold laser. It goes up to 4, which one day we will get. But basically the cold laser, it goes into the mitochondria of the cell, tells it to reproduce more cells. And so it really helps speed up the healing process because we've released the tension from the nerve, from the muscles, and we've released the disc, putting pressure on it. However, it still takes time for it to regain that communication. And so that helps speed that up. And then we're working on neuropathy patients with some of these protocols too. And we have our nerve stim. And basically you put your feet in a bath, and it basically sends signalings up through all the nerves of our legs, feet, goes through the sacral plexus and then back down. And so it's basically reforming nerves in the body. And the Cancer Centers of America use it for our chemo patients that have neuropathy. And so with the protocol that we have at the office, we're seeing some really great things with neuropathy too, which is extremely exciting because everyone's told there's nothing you can do. There's nothing they can do. I'm just kidding. But yeah, so there's options for people. And so
I absolutely love that.
yeah.
Thank you for that.
You're
Yes,
very
that's
welcome.
I wish I
yeah,
knew you
no,
when I was like 14
right?
years old, but I don't even think you were born then.
Yeah,
When
that
I
doesn't
was,
look like it, right?
no, right? When I was 14, I was diagnosed with scoliosis,
Mm.
and I saw a chiropractor for it, and it was the bone cracking type.
Mhm.
But I was on the floor after every treatment with ice on me, and it hurt so bad that, and they were like, we can't cure you, we can't fix you. We're going to, first they were talking about a Milwaukee brace or
Mhm.
putting an actual rod in my spine. I'm I'm a teenager, and there's telling me once that happens, I won't even be able to pick up my own child. And I'm like, no.
Mhm.
So I didn't see a chiropractor for, I was so scared of them. I
Yeah.
wouldn't go to them. And it wasn't until I actually popped up my SI joint, didn't know what it was. All I knew is I was stuck in this position. I couldn't, you know,
Mhm.
and I went to the hospital, and they thought I was there trying to get drugs, and I really was in pain.
Yeah.
And when I
Wow.
finally went to a chiropractor, and she was able, she sounds a lot like you, like she had me walk back and forth. First, she put her elbow, which made me cry, but she loosened it up first
Yeah.
before she put the joint back in place. But yeah, I wish I knew you then, because all
Mm,
those years of back pain, all those years of, and it was probably also ways I was eating or not moving or not breathing that affected it deeper, right?
Oh, absolutely. I find a lot of my young scoliosis patients, if you think about it, you're twisted, and so your diaphragm's not able to expand as well as it could be. So it's not just adjusting. We need to do exercises to train your body to try and go the other way. Because if you're constantly leaning into it, but you don't know, like, hey, maybe I should try and lean this way. Don't get me wrong. No, we are not going to correct a scoliosis that is juvenile. You're born with it, but we can definitely help mitigate a lot of the symptoms, help prevent it from worsening as you get older. And you should have been offered exercises or
mhm.
even do physical therapy or something, because that's absolutely, it's
Yeah.
not easy to hear at a young age. So I really, my pediatric patients, I try and explain to them this is going to be a little uncomfortable at first, and then it gets easier every single time. And so I really, like, my heart goes out to them because I know how scary it can be trying to get adjusted as a kid. So
Mhm.
yeah.
My husband's sister has really bad scoliosis. Like she is
Mhm.
bent right over now. Like
Yeah.
she's in her 60s, I believe. If she's listening, sorry if you're not, but I believe she is. Yeah, she's older than him, so she's got to be in her early 60s. But yeah, she's really having a rough time with it. Over the past
Absolutely.
few years, she's bent right over. Poor thing.
That's
Yes.
hard.
Yeah, yeah.
So, like, as we get older, like I was saying, that musculature kind of forms with it. So it's hard to say how much can be improved, but it might not just be the spine at this point. It's
Mm,
probably lots of different factors going into it. And if she can get some exercises, if she can get some shockwave therapy, good
mhm.
adjustments that are, gentle enough for her, I'm sure it is not going to be the most comfortable thing. I will say that,
No,
especially for
yeah.
something so complex. And it's a lot of work, it's a lot of effort, it's a lot of time and energy. But at what point is that, it's worth it, right?
Yeah.
To not
Yeah.
be stuck in this position. But if you can get it before it's that bad, imagine how much more you can do.
Yeah.
Getting adjusted at 14, that shouldn't have been a bad experience, because then you could have had so much better spine health within these last few years. And so,
I mean,
Absolutely.
my courage, it's like an S.
Mm,
So instead of coming out this way, I'm just kind of like this. Do you know what I mean? So yeah, I have that. It's constant. Like, so I do get a lot of massages, physiotherapy, I go for
Mhm.
like I do. But then when I started my own health journey with menopause, man, the like what you're talking about, functional medicine, like all these new things came into play, and I'm able to get my hands on them now before the damage is to the point like Tracy's sister-in-law where I'm bent over. Like I can feel the hump up here, and it's like, no, 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 no. I'm doing everything I can to stop my
mm,
whole body from doing this. But it's a constant, make sure that I'm constantly on top of it.
Motion is
For
lotion.
you.
When you're in pain, you don't want to move. And so it's like, it's a battle that people are constantly fighting. So if we can get you feeling a little bit better so that you can get some movement in, that's huge.
Yep.
That's
Yeah,
absolutely huge.
absolutely. When I was a kid, when I was 14, I went to the chiropractors almost every week. Like we were a big
Yeah.
chiropractor family, right? We always went to there. And I was a big baseball player. I always played baseball every year. And I was good at baseball. I could really hit a ball, everything else. Then there was one summer I could not hit the ball to save my life. Didn't know what it was, went to the chiropractor, and I was out of whack. So that hand-eye coordination gone, right? So it's crazy, those little things you just think, well, maybe something has changed, but it's just a simple adjustment, right? Can align everything back up. Um, as it made me realize just how much our alignment affects the things that we didn't expect, right? So, what are some other surprising signs like balance, coordination, or even focus that women might notice in their day-to-day lives that suggest there could be, a benefit from a chiropractic visit, right?
Absolutely. Yeah. So, like you said, balance is huge. If you're
Mhm.
starting to feel like a little off balance, I mean, that's even vertigo we can help with, right? With the adjustments. Sometimes it's C1 up in here, not aligned properly. So vertigo, um, difficulty balancing, bumping into things a lot. Some people are like, I'm just clumsy. Your nervous system's probably not quite where it needs to be. Brain fog is huge. But brain fog, I feel like with so many of our metabolic problems, also comes with that. However, adjustments can definitely help clear things up quite a bit. Let's see here. Tension in the shoulders constantly. Common, not normal. Yeah, exactly. And then yeah, weakness. Like if you're like,
Mm.
oh, now this side's a little bit weaker today, that could be your nerves being irritated from your neck because all the nerves of our neck go down into our arms and hands. All the nerves of the low back go down into the legs and feet. Sometimes it's knee pain, sometimes it's hip pain, all stemming from the low back. Not to say that you can't have two things wrong. But if you're like, I didn't even do anything, it could be just a referral pattern, is what we call it, from the spine. So, yeah.
Interesting.
So
Good,
like
thank you.
if you're going on a walk and all of a sudden one of your legs just say, I don't feel like walking anymore, that would be like your lower back.
Potentially, yeah. Yeah, I mean, there would need to be a workup and an evaluation, but
Oh,
absolutely.
I would love to come see you, but you are near Lorraine, a country away. Wow, because you're just like you're
Road trip.
rolling off my symptoms here.
No, there's lots of good chiropractors out there, but definitely like doing your due diligence too. Just like every MD is created equal, every chiropractor is,
Absolutely.
not created equal. And so finding someone that's going to really take it seriously and figure out a problem and then have additional therapies because I would love to fix everyone with my adjustments. I help quite a bit. We can't do it all. And so there might need to be additional support on top of that you might need.
So the question would be like, but from what I'm hearing from you, like you're not symptom chasing. You're getting to what is going on. Like you're not just talking about a chiropractic adjustment, you're talking about nutrition, you're talking about breath work, you're talking about not just chasing symptoms, but getting to what is going on in them. So I guess if I was going to say a question is, do you find that women's healing often accelerates once they shift that mindset from something is wrong with me and just putting the band-aids on them symptoms to what is my body's asking me and how can you support them?
Absolutely. I feel like it's knowledge is power in your body. But a lot of it is a nutrition aspect. I feel like women have a much, much greater risk of autoimmune diseases, chronic pains that they just get brushed off. That's just how you're complaining. It's in your head, it's anxiety. That it's just huge. We see fibromyalgia so frequently. I'm like, I can do whatever I want chiropractically. I'm not fixing this, right? Like you need more support. You need additional options because I'm just going to make it a little bit more uncomfortable at this point because yes, we're helping regulate the nervous system, but your nervous system's that sympathetic is through the roof. And so we're not we can only do so much. So if we have like a fibromyalgia patient, like we have options. We do, I believe it's Dr. Codman drops. They've been great. It's a nutritional proprietary blend that can get some of the inflammation down, and then we can help them chiropractically. But at the end of the day, it's a whole like we got to put the fire out before we do anything else for you. And so we find a lot of autoimmune with the women that come into our office. And so knowing our boundaries too, like some of this I can help with, some of this is going to be you taking your nutrition under control, you regulating, you learning how to do breath work. And so I'll do diaphragmatic work on a lot of these women. And so basically it's more of a myofascial or a muscular. So the diaphragm's a muscle, it contracts and relaxes. And if it's constantly tight, you're not going to be able to get oxygen to the proper areas. The anxiety gets worse. The sympathetic nervous system gets increased because they're like, we're not getting any oxygen. So I'll work on some of that, especially with even if they don't have something quite that's autoimmune, but they're just chronically in pain and you can tell they're just chest tightness, anxiety. And I'm like, we help relieve the diaphragm and we can relieve a lot of that stress and tension in them because they're actually able to take big, deep breaths and are able to get that proper respiration that they should be getting. And then teaching them, like, you breathe through your belly, not through your chest. Like, yes. I remember when I was younger, I was constantly told, tuck your belly in. I was like, okay.
Thank goodness they stopped that, right?
That was
awesome. Suck it in. Yeah. Oh my goodness. Yeah,
it is always so crazy how we learn about each other. Cynthia, I have a story to match you, and Tracey, I have a story to match you.
Oh my gosh, no way.
This is so crazy. First of all, I also have an S-shaped scoliosis,
what?
Which is crazy. I do. Secondly, the first time I went to a chiropractor was when I was in your prone position or I woke up one morning, I was like in my early 30s. I must have been 21, 22 years old. I woke up, I got out of bed and I couldn't stand. I literally like my hitch was locked. And so I'm walking around my house and everything. And I called a chiropractor and went in and he put me on some machine. I don't really know what it was. This was, 40 years ago, but I think it was like massaging me and it also had heat and stuff. So he like loosened up whatever before taking x-rays and giving me an adjustment and everything. But finally I was able to like stand up. So that's how I got introduced into chiropractic. And then Tracey, I always had long periods, but this one was really, really long. It was over 42 days. And this is when I was having periods normally. And I went in to the chiropractor and I said, my period is late, but I'm obviously not. I was probably in my 40s. I'm obviously not pregnant, And so I just thought maybe I could use an adjustment. And sure enough, I had an adjustment. And 2 hours later, I started my period. So
wow.
I've covered both of your stories. It's just crazy.
Oh, there's some things we share that I wish we didn't. Like some of the things from our past, like I really wish you didn't have an S-shaped spine like me. Like there's things that it's like, oh,
yes,
a lot of similarities. That's funny.
I've had it all my life. I mean, I cried when he showed me the x-rays. I was 21 or whatever. And I looked at it and first I was just shocked because it took me a minute because my spine went like that. And it took me a minute to kind of comprehend what I was looking at. And then I just started crying, and thought, oh my God, I really am broken. But, over time, I've learned that I can deal with it. I watch how I do things and I manage it as best I can. And of course, Dr. Madori is helping me manage it even better.
Very good. Awesome. I love how you talked about the fibromyalgia because I suffered from that myself. And so I know when you talk about the pain, it was just, I couldn't go to car. I couldn't do anything like that. It was intense. But I changed my diet, changed my mindset, and Yeah, it's gone. I don't have
Yep.
that anymore.
Complete
Yeah,
remission. It's
so
incredible.
yeah,
And you go
yeah,
to the doctors and they're like, you can get gabapentin, you can
yeah,
get something to,
yeah.
quiet the noise, but I'm like, it's
No,
not
nope.
realistic. And
No.
then like just trying to like even do my assessment on these patients, on these,
Mm.
most of them women,
Mhm.
they are so lit up. It takes so long for them to even get a diagnosis. Most women don't get diagnosed until I believe they're in their 40s or 50s. And
Mhm.
they've been suffering with this for years, so many years. And they're like, oh, it's anxiety. Oh, it's all these other things. And they have to go through this crazy blood work. And then it's literally a diagnosis of exclusion.
Yep.
Mhm.
They don't know what's going on
Yep.
and they don't know where the pain's coming from, but that's their final decision at the end of the day. And so
Yeah.
like how was that? And you have nothing to do for it. Like
Right. Yeah. Yeah. Thank you.
Yep. And how is it on the rise too, right? Like, but then you're
Yeah.
looking at the cause. You're like you said, they're lit up. Their nervous
Yeah,
system,
nervous
their
system.
diets, their breath work. Like we're in
Mhm.
a society that is so stressed up, so bottled up, and so yeah, those diagnoses are on the rise.
Absolutely.
Mhm.
I'm finding it at such young ages,
Wow.
such young ages. Autoimmunity just in general is so high right now, and our body is literally attacking itself. That's an
Yeah.
autoimmune
Yeah.
disorder.
Yeah.
And it's just we don't have like the nutrients or the resources to even fight it or know where it's coming from. And everyone like manifests either it's like autoimmunity, some people manifest it as diabetes, some people
Mhm.
manifest it as Alzheimer's. Like there's so many different ways for it to even manifest. And then most of
Yeah.
it down to mitochondrial function, which is if we can get that taken care of, or like the gut not being able to absorb the nutrients. But everyone's so different in the way they manifest things. But at the end of the day, it's almost all based on our
The
lifestyle. Like
same
you
thing.
said,
Yeah.
we all just manifest it slightly differently.
Yeah.
Speaking of that, another great segue. I wanted to give you an opportunity to go a little bit more into the functional medicine because a lot of people
Mhm.
don't really know what that entails. Like, what does it mean to do functional medicine? What you're talking about blood work, you're talking about supplements, but you're also talking about foods and small movements and maybe breath work and other things. So can you go a little bit more into what functional medicine looks like should someone take that path?
Absolutely. Functional medicine is a mixture, right? It's more of like an integrative medicine. So you take some of the Western medicine, like getting lab works and doing all of that kind of the stool samples, and then you use more of a holistic approach, something sustainable, right? My goal, at least as a functional medicine practitioner, is to figure out why your body is doing what it's doing, right? Most of the time, we will start off with nutrition because that is going to put out so many fires that we'll be able to be like, okay, now you're still having these symptoms. I can do additional testing to figure out why. And then we just go down the line to eventually figure out, okay, so is it metals? Is it mold? Is it, all these different things? But until we have the nutrition under control, it's really difficult to even find some of that. And so we could do crazy panels that test everything, but that gets so expensive. And so being able to get some blood work, change nutrition as much as we can, and then really start to think about, okay, how much are you sleeping? Right? If you're not sleeping the appropriate amount of hours of sleep, are you even going to be able to do the nutritional changes? Right? Because your body's just in this like constant craving of something because it's not rested. And so we talk about sleep, we talk about exercise. How often are you moving? Because you have some women that are just like go, 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 eat nothing, and they've blown up. And it's like, they're like, I don't know why I don't eat anything. I'm like, you need to eat something. You're moving all the time. And then you have someone who's working a more sedentary lifestyle and she's at a desk job and she's maybe not eating a ton, but she's not getting any steps in. The heart's not working, you're not getting those baroreceptors to contract and relax, and you're not taking deep breaths. Like you were just stuck here on a screen constantly. And so that's stressful. Your spine's not going to do very well in that kind of position either. So we want to take care of, um, exercise, not even exercise, movement, period. Doesn't matter what you're doing, just getting the body moving. And then the mind, body, spirit, right? So they're finding that, and I feel like everyone's after COVID got so isolated. And so community and connection is actually a huge pillar of health for people. And most people don't want to go out and talk to people anymore. And I get it. Like it is, I was very much so, I feel like in that space where I'm like, I'm taking care of me and my mind and my body. And then to like go through all the science that they have through functional medicine about how being in your community, helping others, doing things for other people actually serves you. So still kind of selfish, but no, it just
As
it
we
makes
all should be on some level.
Yes.
and so like trying to balance that, like I need to take care of myself, but also like my community is so important and the people around me are so important that we're all communicating, and just connections are so important. And so figuring out what kind of community aspects do you have? Do you have good relationships? Do you have estranged relationships? Like that plays a huge part too, because if you're going home and you are unhappy, or if you are don't get along with coworkers, different things like that, it is still going to take a huge toll on your body. And so just layers so much. They even talked about religion, doesn't matter what kind of religion, or if it's like you believe in the universe, believing in something larger, and taking that mindfulness, so like meditation, prayer, different things like that play a huge part in our body being able to regulate. And then it's our social environments, physical and social environment. So that would be like the mold toxicity. Are you around secondhand smoke? And then your social gathering. What are you doing on the weekends? Are you doing something productive? Or, not, you're going to be like the people around you. And so what are they doing? Is that what you want to be around? And so really just kind of figuring out all the different layers, because we can change your nutrition all we want, but if there's a lot of other factors going on, we're not going to be able to do that much. And so that's why I think the history is so important, because we can do these little changes as we're changing our nutrition that will really increase our body's ability to function and feel better. So that's kind of going to be my approach to it. I'm practicing right now, mainly family and friends. I have a couple patients, but I just seeing small changes and like the way their bodies are changing, their moods and changing, their cognitive functions changing, like after something so small, just a couple supplements, because there's some, not to say that it's wrong by any means, but some functional medicine doctors will give you so many supplements and so many 10 million things that you have to do. And it's just like, whoa, that's overwhelming. Like I'm not doing any of it. But also understanding it is a huge process. So it's not going to be like I see my functional medicine doctor once and then I'm going to be cured. It's you doing the work. It's you putting in the effort into yourself, and we're guiding you into the optimal way to do it, rather than like a nutritionist. That's fantastic. That's great. They don't have your blood work. They don't know exactly what you're missing. And so basically that is my goal in the functional medicine aspect of things.
I absolutely love that. I agree everything you said.
It's all in line.
Especially,
All
right?
three of
All
us.
three of
four,
us, right.
you
Absolutely.
have to have those 4 pillars of health, right?
Yeah.
Otherwise, like you say, if you don't sleep well, doesn't matter if you're eating well or not. If you're not eating well, or if you are eating well and you're not sleeping, like right, it all works together.
Absolutely.
The one, and again, I'm a big, big believer on get rid of the food, get that noise out of the way first,
Mhm.
right? And then see what's going on. Do you find that I find people still really don't believe or understand just how much food plays in their health?
I absolutely agree. I don't think a lot of people have actually taken like the nutritional advice that they say they've been given, or like taken really dive in. So like with keto or carnivore or something like that, if you're in the in between, right? If you're not fully going into ketosis, you are going to feel miserable, absolutely miserable. And there are lots of things to mitigate it, but if you're doing it on your own, it is extremely difficult. And so most people don't get past that point to where they get that clarity, to where they get, it's really a ton of discipline that first week or so, and making sure you have your proper nutrients and electrolytes in the meantime. But I don't know if they're not getting the proper guidance or what. Don't get me wrong, everyone's diet should be a little bit different. I'm not saying everyone
Absolutely.
can go 100% carb free if you're diabetic, right? Different things like that. Sometimes you need to be monitored, and you're going to, you know, it's not always going to work out because not everyone's genetics are the same. And so
No, like we're all different, right?
yeah.
Yeah.
And so figuring out
Absolutely.
each patient, what nutrition is going to work for them is really beneficial. Like the elimination diet. There's lots of elimination diets though. And so figuring out, who's going to get which one. So the program I'm with IFM, they have a really great one. But again, if you're on medications, if you're diabetic, you have to ease into it. And so if you're not dropping 20 pounds right away, they think like we did something wrong. And it's like, it's not quite how this works. It's a marathon. It's not a sprint. It's going to take a long time. It took you a long time to get here. It's going to take us some time to get back. And so people want that quick fix too, I feel like. And so if you're not seeing crazy results within 2 weeks, it's really difficult, I feel like, for people to stay with. And then just society, right? I get occasional, like even with my own family, like, oh, you're ordering that again, or you ask for so many substitutions. I'm like, if I'm gonna go out and do these things, like I'm paying for it. It's gonna be something that I want to eat. And so like I used to like, okay, fine, like I'll just get the burger and feel crappy afterwards because I don't want to be difficult. But now I don't care. I'm like, I will be difficult. I'm going to feel good. But like there's so much of that too. Like I don't want to be that person. I don't want to be uncomfortable. But at the end of the day, like who cares? You're going to feel better for it. But yeah, there's so much of that dismissal too going on, or being in a family. I feel like moms, they have their entire family and they're like, I have to cook something different. I'm like, do you? But at the end of the day, but I see them not wanting to like make their kids do a huge change at once, because that's a lot on their bodies too. And so coming to the realization, hey, kids should probably be eating a little better too. If you're gonna make it for you, make it for them. But working through that picky eating, it takes time, it takes effort. And if you're already burnt out and not feeling well, you don't want to have to deal with that on top of it. And so I'm like, if you can get you under control and get your fire down, you can start showing your kids what it's going to look like. And so, but it's just double work for them. That do they even get there? You have your snacks everywhere. Self-control is really hard for me. I will empty out my cabinets and I'm like, I can't even look at it. Once I like get back into it, and then once I'm doing better and I'm like more on like an 80-20 type of lifestyle, then I'll start to introduce different things. But like when I need to get strict and get back, like I'm not feeling well, I'm burnt out, I need to change something, like I have to take everything out and then slowly reintroduce, and then probably couldn't reintroduce them, and then I end up back. But
I hear that.
Trying to learn that balance is really, really difficult, but I feel like I'm finally getting much closer. So
good.
Great.
Very, very good.
Cynthia, you have a question?
Well, the conversation is flowing in such a beautiful direction. It's the functional medicine. We're talking about healing from the inside out, but a lot of like you're following all of our pillars, all of our maps, all of the things that we're saying. And as simple as it sounds, change the way you're eating, breathe, move,
Sleep.
decide, sleep, like,
Yeah.
and get your nervous system, like get all that to calm down, like get those fires out, like stop being lit up all the time. Like we talk about cortisol a lot. As simple as it sounds, it also becomes hard. Like even just what you're saying, like you're so busy, like at least 80/20. It takes a lot more time and effort to be sick than it does to be healthy. Like I know it sounds easier to hop in your car and drive to McDonald's and feed your family, but you know what? It's the same amount of time to open your fridge and pull out the
Mm.
steaks and throw them on the barbecue. And the rewards at the end is you're not sick. So yeah, you guys went to McDonald's and you saved yourself maybe 10 minutes, maybe, but I don't think you did. But now no one is sleeping at night. Nobody's pooping in the next day. I sorry to
No.
use that word. Are you allowed to use pooping on it? Okay, whatever. Um,
Or extremely
or
cooking.
do you know what I mean?
Yeah, extremely. Yeah.
We're all sore. We're dehydrated because it's high in sodium. So your
Headaches.
electrolytes are out.
Yeah.
So what you think is saving you time, what you think is saving you money, it is literally health from the outside or unhealthy from the outside in.
Yeah.
So my question would be for functional medicine is when you're talking to your clients, like you said, it's a marathon, it's not a sprint. We're so used to going to medical doctors and getting that prescription or getting that here's the band-aid, now you're going to feel better. Convincing your clients that it is this simple.
Yeah.
How frustrating it is when they're not listening, right?
It is not easy. Yeah. So trying to figure out where they're at is the biggest part. If you're going to go see a functional medicine doctor, you're generally at your wit's end and you try anything. That's maybe the one caveat that is like, okay, we have something to work with here. But it is extremely difficult to figure out what is your priority, as we can start tackling this head on and go all the way in. It is not going to be comfortable. That is it. We are in this huge comfort crisis of everything needs to feel good, and ideally, yes, but we have to be a little bit uncomfortable to get to that point, to grow, to do more. And so that people don't like discomfort, and it's not going to be easy. And to be able to explain that, like, I can give you all of this information. Honestly, so much of the information is already out there. But just tailor it to you specifically.
Yeah.
You have to implement it, or you're going to be continuing to come in, you're not going to get better. And it's at that point, it's not on me. And so, like, to tread lightly in that term, right? Like, I can't say that to them. But to try and figure out, like, okay, are you stressed out at work? What is your week going to look like? What are some things we can do to prepare? Can you bring some snacks with you, some nuts with you, so that you're not starving all the time? What are some ways you can implement movement, maybe 1 or 2 times this week? So not going all in and all of it.
Right.
That has been really, I think, really helpful for them. You're not going to see as big of a difference in the first few weeks, which I think people get a little discouraged with that, but slowly implement, like, critical nutrients. You talk about magnesium, vitamin D, most people need. And so do a couple supplements and you're going to feel a little bit better. You'll be like, okay, this is working. Cool. I see you again. We're going to do a little bit more. Okay, cool. Your body's a little bit less inflamed.
Yeah.
You know this works now. I want to hit it hard. Elimination diets, this. Like, some people are going to need, like, ASAP, you need something done, you need to go all in right now. But the average person, a mom, I feel like it's going to take some time, because now you're not only taking care of you, finally, you're taking care of all your children, you're taking care of all the people around you. So I feel like women are probably, they do so much for everyone else. By the time they get there, they're just kind of like, well, maybe, I don't know, will I have to cook for my husband? Will I have to do this? And it's just like, it's about you at this point. This is your health. This is your journey. And so just trying to encourage them into it's okay to take care of you. It's okay to make these choices. They're either going to fall behind or they can make something for themselves. Or, you are going to be making two meals. And if that's your decision, that's your decision. But something's got to be done because the way we're living right now is not fun. It doesn't feel good. Like you would have more energy to be with your children. You'll have more energy to do the things that you love. There's so many people out there that are just like not going out and going on their hikes because they don't feel good or not doing these things because they don't have the energy. Like how sad is that we don't have the energy to do things anymore? Like it was even just the end of this last year. I'm 30 and I was like, I don't want to do anything. Like I was not eating well. I wasn't taking care of myself. And I was like, I'm miserable. Like, I can't even I felt like I was doing a disservice to my patients at that point when I'm like, how am I going to ask you to do these things when I can't even do them? And so like really diving into the functional medicine at that point, it's like, I need to be able to implement these things because I feel how difficult it is. I know how difficult it is, but it is attainable and it is doable and it's going to take time and that's okay. You will get there. That's the biggest thing I feel like. And so there's lots.
Another quick tip there is
Yeah.
if what I find if you're nobody eats the way I do here, right? So I make my own meals. But I think everybody tries to eat at the same time. I don't know if anybody sits at the table anymore these days, but cook your own food first and eat. So then when you are cooking maybe that stuff you would crave or you want to taste it, you're not hungry at all. So that um that temptation is gone, right? You've
Yeah.
already tell you with yourself. So just a little eat first and then prepare the other stuff.
Absolutely.
It's a handy little tip too.
That is a very good tip.
Thanks.
Yeah, and
Good,
I
good,
think
good.
mindset plays a part too. We want to make sure that people get in the proper mindset and are telling the right story about their changes instead of oh my gosh, this is going to be so difficult and this is going to be whatever. Have that wow, look what I'm doing for myself now, and look at how much more I'll be able to give my kids and much more I'll be able to give my husband, and those little victories that you give them, your inflammation's a little down, you're doing such a great job, and look at how much you've accomplished. And so mindset is a really important avenue to take to when you're facing these kinds of challenges.
Yeah. So I think that's probably one of the biggest challenges. And so sometimes I'll have them, like some people don't like to journal. I try and do some of that or like find a meditation technique, but figuring out where they're at mentally is probably one of the biggest parts because so many people are like, yeah, I want this, I want this. And so I think absolutely those little wins are going to be what keeps you going in the long run. So did you everyone's like, I want to lose weight. I'm like, well, did you move better today? And did you feel less achy? Did you have a little bit more energy? And so like reminding them those are key factors in healing, like feeling those different things rather than just everyone focused on maybe losing weight, which I feel like could be a big focus for a lot of women.
Yep. And getting a healthy body is a slim body, right?
Yeah.
Like it's not that's but it's yeah, absolutely you lose weight if everything is
Yeah.
balanced and working, right?
Absolutely.
So
You've had such a fascinating journey. I mean, the hospital and then the chiropractic and going through all of your schooling and then now this new functional medicine, and they do weave together, and I love that whole person, look at things, the root causes and everything. So that is just awesome. So let's go into our practical tips and how listeners can use this. So for women listening today, not everyone has immediate access to a chiropractor, and especially I think it's more difficult to find a functional
Mhm.
medicine practitioner. So, are there some practical steps that they can do to start caring for their health in that same whole person way until they're able to maybe find a practitioner for them?
Absolutely. I would say I feel like getting steps in can be really beneficial. Everyone thought 10,000 was like, you had to make it there or you weren't getting any benefits. They actually find that 5 to 7,000, you still decrease your risk of disease up to 30%. And then anything over that 7,000 is just extra bonus that you get. So movement is huge. If you're at the point where you feel like you really can't move, working on some postural exercises can be really beneficial. So all the muscles around our spine are lots of muscles there too. And so if we can get the nervous system to communicate better, your body might be able to communicate a little bit more. So especially people that are at desks a lot, I really like this one. So basically you stand up, your feet, you have to pay attention to your feet, right? They have to be completely straight and neutral. And then your body is straight. You bring your hands out and then your thumbs are coming down. They come to your forehead. And then you bring your elbows in all the way to hopefully touching. Not everyone can get them to touch right away. And then open up and try and get them to touch that way. And then you bring it in, open up. You do that about 20 times. It's a workout because you're like, when do I ever use these muscles? It's not easy. So do that quite a few times, especially after us sitting here for so long.
The computers, right? Yeah.
And relax, and you'll notice your shoulders are a little bit. Shoulders are relaxed.
I feel better.
Yeah. So that can be a really nice one for people sitting at the computer. Sit to stand desks are going to be beneficial. And then I would say introducing more nutritious food rather than trying to take away right away. So like small things, maybe add an extra serving of vegetables and protein to your meal before you decide, or like when you're eating something, add more so you feel a little bit more satiated. And then what was the other one I had? One more time, what was the question? Some tips and tricks?
It's some, yeah, practical steps that they could do to take care of their health in that holistic way.
Yeah. Hydration, huge.
Oh, yeah.
Lots of water. And then I would say getting some sunlight, getting outside, step outside for the first, let's say 20 minutes that you wake up. Getting that sunlight into your eyes, it actually can help decrease stress markers. And that can be extremely beneficial for, I would say, most everyone in our lives. And so if we're able to get the first 20 minutes of our mornings, some good sunlight, that actually can really decrease inflammation and decrease stress in our bodies. So get you ready for the day. It sounds so silly. I'm like, sunlight and water for a health plant, but it is so important. And those are, I think, small things that we can do to start feeling better, because then you're getting the vitamin D on top of that. And so, yeah.
I just talking about the functional medicine, right? As I had mentioned, I had fibromyalgia. And so now I work with people, right, with fibromyalgia and the autoimmune issues like Hashimoto's, which I also have now still, colitis and IBS, right? So we focus on changing what they're eating, right? Their movement, mindset, everything we're talking about. Is there something additional from a functional medicine perspective that they could do over and above just changing those little things? Would it be like supplements, or what would you recommend for someone like that?
I feel like it depends on the person, right?
Okay. Yeah.
Depending on where this autoimmunity is coming from. Is it the food? You'll know pretty much right away if it's the food. So you'll find, I'm sure, some of those complex cases where you're like, I changed my entire diet, I still have symptoms. Sometimes it's genetic. So diving deeper, basically trying to figure out, sometimes they need a whole gut cleanse. And we need to kill some of the bad, like you said, some of the parasites, bacteria, introduce new bacteria. So they call it like the 4 R's. It's replace, I can't even think of them right now, but it's the 4 R's of functional medicine: reinoculate, reduce, I can't remember, but basically you're changing the gut microbiome by reintroducing good bacteria to it. So just depending on where the autoimmunity is coming from, some people have like mercury and lead in their blood that are causing some of this autoimmunity. Some people are getting it due to mold. So if you're like, I cleaned my entire diet and this isn't changing, we have to look a little bit further, I believe sometimes. Supplements are great. But say we're taking supplements and our body's not absorbing it because I have MTHFR gene. So
Okay. Yeah.
I don't methylate my B vitamins. And so that was huge for me. So that's energy, right? That's
Yeah.
so much energy in our bodies. And I was 25 years old and burnt out because it was COVID and,
Oh,
all that
yeah.
fun stuff. And that's why I started my functional medicine program because I'm like, I'm way too young for this.
Yeah.
And so during my process, I found out that I have that genetic disposition. And so I need actually pre-methylated B vitamins.
Mhm.
That's how my body's going to absorb it. And I'm like, I never
Yeah.
taken B vitamins.
Wow.
Right. Yeah.
And
That's,
who would
oh my
know
God.
that?
So glad we talked about that.
Nobody
Yeah.
would know that,
Nope. Nope.
My family, my mom's always said, I don't tolerate B vitamins. I didn't know that was a genetic thing. We didn't
Yeah.
know
Wow.
it's a gene. And 40% of people actually have that gene. It's way
Right.
more prevalent than they ever thought.
It's
So
crazy.
it is
Crazy,
crazy.
crazy.
So everyone's going to be a little bit different in finding out
Yeah.
why
Yeah.
you aren't getting better. I think that's the
And again,
biggest.
it comes down to cleaning up your food first, right? That's what I
Absolutely.
did. That's when the
1,000,000%.
Hashimoto's, yeah.
Mm-hmm.
Because it's
You
like,
will
why am I
see.
still suffering with these certain things that were coming back? And that's what it
Absolutely.
was. Yeah. So very interesting stuff. Sorry.
It is.
Okay.
Body's incredible.
That's okay. No worries.
Good.
Go ahead, Cynthia.
One thing I was thinking when you were talking about like the practical tips and what you just shared right now is, do you remember the acronym KISS? Keep it simple.
Mm-hmm.
Silly.
Sweetheart.
Keep it simple. Yeah. But while you're talking, it was like, kiss me softly, right?
Mhm.
Like keep
Oh.
it simple, but softly. Like we're talking about adding things into your diet, going stand in the sunshine, movement. Like it's not that 10,000 steps, even you get 5 to 7. So a thing that women, that our listeners can put into their mind right now is just think, kiss me softly.
Mhm.
Keep it simple, but it's softly. You don't have to go hardcore. Like add
Mhm.
things into your diet if you're not comfortable taking things out. Go
Mhm.
stand in the sunshine. Like to me, this all sounds like
Mhm.
waves in, waves out, so beautiful.
I
You
love
aligned
it.
beautifully with all three of us. Like, thank you so much for coming today. This was awesome.
This was a lot of fun. I really
So
appreciate
good.
and having this conversation and just knowing that, what I am doing, it works because you guys are
Yes.
living proof of it, right? And
Yes.
just knowing I'm on the right track too, because this is a newer journey for me and I believe in it wholeheartedly, and to find
Yeah.
people that are doing very similar things. We need more of it. We need these voices out here, and you guys are a blessing to be able to put this
Oh,
information out there. So thank you guys for having me
oh,
on here as well.
Oh,
thank you.
thank
So
you
nice. We got
so
our tribe.
much.
Right? We have our
This has
tribe.
been a wonderfully powerful conversation.
So nice.
So we're going to do a wrap up here. And so I'd love to ask you one last thing. We've already talked a lot about what to do and this and that. I don't really need a question. I'm going to probably just make a little statement because we have kind of talked about this. But to piggyback onto what we were talking about small steps, sometimes someone can get overwhelmed at the thought of 10,000 or 7,000 or 5. I mean, it sounds so much, but just an average day, a woman vacuums her house, runs after the kids, cooks, does laundry. I mean, you basically can get 7,000 steps, no problem. But for those women that are sedentary and they're not as active, what we really mean by softly and simple is if you take 10 steps more than you normally do, that is a victory.
Yes.
If you can walk somewhere that you normally wouldn't have, that is something to be proud of. So we're talking about just doing what you are capable of at this moment. And then before you know it, 10 steps will be 12 steps, will be 20 steps. And if all you ever get is 100, but that's 100 more than you ever thought you'd be able to do, then that is great. So I really wanted to kind of press that upon everyone.
I appreciate that. And then you talk about mindset, right?
Mhm.
So studies show that women who believe what they do is exercise, what they do for work, um, you will lose more calories than the person who thinks they're just working. So
Oh,
even, yeah, it's all
I
about,
did
interesting.
read that study. That is fantastic.
yeah.
That makes sense. That's so fun.
Cynthia, did you have some last comments?
Uh, I've s- I wanted to say, Dr. Madori, I really appreciate how you have highlighted empowerment because that's the piece so many women are craving, or even men, if there's any listening. It's not just about being treated, it's about
Mhm.
being educated, supported, and trusted with our own health decisions. So thank you. Thank you for being here and reminding us of that today. So let's all go out there, ladies, and kiss me softly.
Yeah.
And Tracey?
Okay, thanks. Yeah, thank you so much. This is fantastic. As with like so many of our episodes, the most powerful message is this: we need to shift from simply managing symptoms to truly supporting the body. There are so many natural tools available to us, especially nowadays. And depending on your health condition, you may need to bring in more than one, which is totally fine. But don't let that overwhelm you. Just start with one thing and build from there. Like you say, that if it's 2 steps, 20 steps, whatever. Healing doesn't have to be complicated. It's about creating the right environment so your body can do what it was designed to do and heal itself. Thank you. Thank you. Thank you.
And on that note, we may have to adjust our time. We usually say women over 35, but with Dr. Madori being 30, I think we can just lower
Yep.
our women over
Yep.
30 and we'll just be
And
right there because we want
yep. Yep.
and welcome all, any ages and
Yes.
any sex. You're all
Yep.
welcome. So I want to thank you again for coming in. This was so wonderful of you, and I so appreciate it. And I have an appointment tomorrow, and I'll see you then as well. And of
Nice.
course, we look forward to your mother coming on, Dr. Sarah Griffin, and she'll be on in 2 weeks. And we'll dive a little deeper into the neuropathy, and that is going to be
Mm,
fantastic. So I can't wait for that.
very cool.
So I want to make sure everyone can connect with you, learn more about your work, or even visit you if they're local. Can you share the best way to contact and find you?
Absolutely. So on Instagram, we're at, oh, what are we? Is that, sorry.
It's acc.chiro.
ACC. Well, I'm trying to figure that out.
It will be in our show notes.
It
So
Yeah.
will.
Yeah.
It
anyone who
will.
listens to this episode will have your contact in the show notes.
Our
Absolutely.
website is activecarechiro.net. That's what it was.
Oh, your
Nice.
website.
Yep.
Okay. Thank you. And I wanted everyone to know what your business was called, and you're located in Hesperia, California.
Victorville, California.
Victorville. That's
Yes.
right. I'm the one in Hesperia.
And now we are doing a promotion for $47 donation to a Core Solution, which is a local charity up here for a free consultation, exam, and adjustment, but it'll be the $47. So that is what we are
Wow.
right now.
That's
So
That
very
is a
nice. Love
fantastic
that.
promotion, let me tell you. And they
Yeah.
did the whole work, so it's wonderful. So we will have in the show notes your website, any social media you have, any resources, and of course the offer will remind everyone of what that is. So thank you so much.
thank you
And
guys.
we have one last thing. We're just going to do a challenge. And this week, it is to find one small way to take a whole body approach to your health. Take a walk, do some simple movements, and definitely listen to your body. Even if you just sit there and breathe, you can listen to your body and have that mind-body connection come about. So, Cynthia and Tracey, thank you for making this another great conversation along with our wonderful guest. It's always so much fun to listen to and learn from both of you. And to all of our listeners, don't forget to like, subscribe, and share this episode with a friend who might need it. We're so grateful to have you listening today. We hope you're leaving this episode feeling more inspired and empowered. Until next time, remember, it's never too late to be the you are meant to be.
Thanks for tuning in to the Happy Healthy Her podcast. If you enjoyed this episode, be sure to share it with anyone you think would benefit from the topics we're discussing. We'd love to hear from you. DM us with your thoughts, comments, or ideas for future episodes. And don't forget to check out the links in our bio if you'd like to connect with any of us or learn more about what we do. Until next time, remember, in a world where you can be anything, be kind, be happy, and be healthy.